Confirms now that the state's first case of sexually transmitted Zika virus has been found. The case involves a woman who's not pregnant and who was infected by her male partner.
Male partner traveled to Brazil earlier this year, developed symptoms of Zika, returned home to Georgia, and then subsequently infected his sexual partner, who had not traveled at all out of Georgia.
Well, this is the 11th documented case of sexually transmitted Zika virus here in the United States. All of the cases are travel related. This outbreak has left couples with some difficult choices about when to start a family. The Fox Medical Team's Beth Galvin explains.
The CDC is now advising pregnant women not to travel to almost 50 countries and territories, most of them in Latin America and the Caribbean, where there is active Zika virus transmission. And one local obstetrician says the Zika outbreak has left couples here planning a family facing some tough choices. It's a frightening scenario. A Georgia man returning from a trip to Brazil tests positive for Zika virus disease, then passes the virus on unknowingly to his female partner through sex. Fortunately, she was not pregnant.
Hello.
But here at North Atlanta OBGYN, Dr. Meera Garcia is increasingly talking not just to her female patients, but to the men in their lives about how to protect themselves from a virus being spread by mosquitoes and, in rare cases, sex in close to 50 countries and territories and counting.
There are actually situations where I recommend that my patient bring her a partner or spouse in. A lot of times these situations are when the spouse travels for work and travels to these areas.
One of Garcia's patients, Alyssa, Drishpon, got pregnant this winter on a family trip to the Dominican Republic before the CDC began sounding the alarm about Zika virus. She's tested negative for Zika, but is still getting monthly ultrasounds to track her unborn baby's development as a precaution. In all, the CDC says nearly 300 pregnant women here in the U.S. and its territories have contracted Zika virus, all through travel to areas where mosquitoes are spreading the virus.
We have had definitely patients who have panicked and we had to be talked off the ledge, so to speak. We've definitely had patients who are either in the process of making plans or have just returned who wanted to talk about it.
The CDC is concerned about Zika virus because the virus seems to target fetal development and can cause severe birth defects in babies born to women infected during their pregnancy. And there's no treatment and no way to prevent it. So Dr. Garcia is telling couples who are pregnant or trying to get pregnant and considering travel, they need to make a choice.
You know, if you're thinking about conceiving in the near future and you're thinking about traveling to the Caribbean, Central America, or South America, we have to change one of these two plans.
If you choose to travel or you can't avoid it, Dr. Garcia says it's important to use contraception to delay getting pregnant just to be safe.
It's a hard decision. It's very hard to tell someone when they should or shouldn't conceive. However, contraception is so important in this situation for the patients who want to travel and are willing to postpone their pregnancies.
Right now, there's no local transmission of the Zika virus here in the continental U.S., but that could change as we move into summer and mosquito season. So the CDC is advising pregnant women to wear an EPA-approved insect repellent to try to avoid mosquito bites. For the Fox Medical Team, I'm Beth Galvin.